Hello everyone. This presentation is on TCM, also called Stop Coughing Powder. It is on the California Acupuncture Board Herbal Formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, TCM belongs to the category relief cough. A representative pattern is cough after an external invasion when the pathogen remains and the lung chi does not descend. Important ingredients include Zai Wan, Bai Bu, Jai Jiang, Bai Qian, Jing Jai, Chen Pai, Gan Cao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 47-year-old woman with lingering post-viral cough. The current medicines are hydrochlorothiazide, omeprazole, dextromethorphan as needed. This case gives a possible reason to consider TCM, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Gan Cao plus hydrochlorothiazide. The mechanism is that licorice may lower potassium and raise blood pressure. The clinical significance is moderate with longer courses. My management plan is monitor blood pressure and electrolytes. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Chen Pai plus oral medicines. The mechanism is that citrus peel may change GI function or medicine tolerance. The clinical significance is low. My management plan is separate dosing, if needed. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is multiple cough products. The mechanism is that patients may combine this formula with OTC cough suppressants or sedating cold medicines. The clinical significance is moderate practical risk from regimen complexity. My management plan is review all OTC products and simplify the plan. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, TCM may be reasonable when the patient truly matches the pattern cough after an external invasion when the pathogen remains and the lung chi does not descend. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.